Hello, this is Dr. Dean. Eye injuries can happen under most unsuspected situations. They don't just happen during bar fight or car accidents or July 4th fireworks. For example, have you ever been hurt by a person very close to you? If you think about it, they have the most access to you, therefore more opportunities to hurt you while you have your guard down, typically around them. In fact, a lot of patients that I've encountered over the years have injuries by their loved ones, namely kids and pets. And here are their stories. Susan was playing with her 2-year-old son when a boy poked her in the left eye. She said, "I could feel the nail going in." She immediately had pain, burning, tearing, and could not open her eyes. She went to urgent care and saw me a day later. Her left eye was red, tearing, and she was very miserable. Her vision was also slightly blurry. Examination with a slit lamp, which is a microscope with a bright light, revealed that she had a corneal abrasion. Cornea is the clear film in the front of the eye. It is a thin layer of tissue that is composed of 5 sublayers. The outermost is the epithelium, and it's broken in Susan's case. This is a bit like when you have the surface of your skin broken, except that the cornea is much more sensitive in terms of pain because it is the most densely innervated tissue in the entire body. The epithelium is the outer protective coating of the cornea. When this layer is broken, not only will you have a lot of pain, but this opens a door for the microorganisms to get into the cornea and cause infections. The infection of the cornea, called a corneal ulcer, can be a dangerous complication of a corneal abrasion and may lead to vision loss if delayed or no treatment is initiated. So in her case, I prescribed a strong antibiotic eye drop, moxifloxacin, to be used 4 times a day in the next 7 days to prevent infection from happening. A week later, she appeared with a much more comfortable eye. The redness was gone, no more tearing, and her vision was also improved. The corneal epithelium appeared to have healed completely. However, that was not the end of the story. In the following months, she started having pain in the left eye when waking up in the morning. The pain went away after a few hours, but would come back again in the morning again. Being a mom of a 2-year-old, she did not have time for herself, and since it always went away on its own, she never called our office. Over time, this also got better, and she would experience the pain about just 1 morning a month. Now she was again in my chair, and for this time was for her yearly routine exam. That's when I learned about her intermittent eye pain. Her eye was normal that day, and her history said that she developed a condition called recurrent corneal erosion, where the corneal epithelium sometimes would rip open when wake up in the morning. I talked about this condition in another video, linked in the description below. You can learn more about it there. I recommended Refresh PM ointment every night before bed to protect and prevent erosion in the morning. You can learn more about selecting artificial tears and ointment in my other video below. She loved her son obviously and did not blame him for this. Having kids myself, I know how easily you can get hurt by them. Everything on a baby can be a weapon because they cannot control their movement well. Their big head can suddenly drop on your head, your nose, your lips, and of course, your eyeballs. My toddler son loves the head bump game and giggles when I groan in pain. Their elbows can jolt you real good in the eyeball as well. Let's not forget about their fingers and feet. Both can innocently jab at your eyeballs, causing scratches or blunt trauma. So when you play with babies, especially in the lying down position, be on the guard for yourself. But babies are not the only injury hazard. older children can hurt you too. Tom was teaching his 7-year-old son baseball, and unfortunately he took a hit on his right eye. The ball did not hit his eye too hard. Thank goodness, his son was not that good yet. But he nonetheless felt a lot of soreness and became very sensitive to light. When this did not get better after 2 days, he came to the office to see me. His eye appeared red, but not tearing or overflowing with discharge. Examination showed intact ocular surface, so no corneal abrasion, fortunately. But there was a moderate amount of pigmented cells in the front chamber of the eye. So he suffered from traumatic anterior uveitis, which is inflammation caused by trauma. This can make people's eyes very sore, very sensitive to light, and red in appearance. When trauma is substantial, the back part of the eye, the retina, can also be involved. Fortunately for him, everything else is normal. Sometimes people can also have bleeding in the front chamber of the eye, called hyphema, but fortunately for him, again, that was not the case. So I prescribed prednisolone acetate drops. This is a steroid to reduce inflammation. I also prescribed a dilating eye drop to stabilize the iris and ciliary body. Therefore, this could reduce pain. A week later, he was much better. There was no more trace of inflammation, and his eye was no longer red or light sensitive. Several weeks later, I checked his angle, which is the drainage system of the eye, to make sure there was no damage from the injury. And there was no damage there. Had there been damage, the drain may not work well over time, and eye pressure could go up, causing glaucoma. This could happen years after the injury. When doing sports that can potentially injure the eye protection has to be worn, even if just playing with a small child. But children are not the only loved ones that can hurt you. Your dog can do some damage to your eyes too. Not as often as inflicted by toddlers, dogs give their owners corneal abrasions from time to time. I don't have a dog myself, but I know they can be overwhelmingly friendly and playful, and some big dogs easily stand with their paws at an adult person's eye level. That is definitely something to watch out for. Dogs are not the only pets to inflict eye problems to their humans. Cats do it too, despite their small size. They don't have to scratch your eye to cause harm. They can scratch you anywhere, and a condition called cat scratch disease may show up in your eyes. This is an infection caused by Bartonella henselae bacteria that can infect a cat bitten by fleas. So a disclaimer here, not all cats will harbor this pathogenic bacteria, but up to 40% domestic cats carry this pathogen. Cat scratch disease can affect the brain, the eye, the heart, or other internal organs, and a person will likely show fever and other symptoms of being sick, even if just for a while. In the eye, the person may have blurry vision, red eye, and examination will show inflammation inside the eye, with macular stars and edema, and optic nerve edema, and retinal and choroidal scars. Fortunately, in many situations, the disease clears up even without treatment, but sometimes antibiotic treatment is needed. Well, who knows, kids can be a source of pain. I know I'm nervous when I play with my son, who's a toddler now. Just the other day, he scratched my finger, and it's still kind of inflamed right here. And one day he elbowed me in the eyeball, and the next day I started seeing new floaters. Of course, not all encounters with children and pets are dangerous, and your love for them will also heal everything, right? Well, that's just wishful thinking. Don't hesitate to go to the doctor if you have pain. That's it for now. Take care and see you next time.